some of my colleagues on the Zoom, and then we'll get started. My name is Peter Gudaitis. I'm the Executive Director of New York Disaster Interface Services, and my colleague Helena Duran is on, who manages our faith sector community preparedness program, as well as Susan Polewski and Khadijah Allen. This is a variation on a self-care curriculum that we use for training disaster spiritual caregivers nationally. Some of the material is specific to COVID, but most of it is general to clergy and faith-based caregiver wellness. So please mute your mic if you are not asking a question, although you should feel free to do that whenever you'd like. You can also ask questions in the chat. We want to certainly give everybody the opportunity to speak who would like to speak. There will be Q&A throughout the presentation, but there's a whole section at the end where hopefully we'll have time to ask questions. And you'll also receive an evaluation at the end of the webinar. If you could help complete that for us in a timely manner so we can get it back to our funders, that would be wonderful. And we'll also send along a copy of the slide deck as well as a recording for the webinar as well. Slide. Okay, so we are now almost a year into the COVID-19 pandemic, which started last fall in Wuhan province, China. The variation that we have on the East Coast of the United States, however, is a version that came to the United States from Europe. The West Coast has a version of the virus that is closer to the Chinese fingerprint, if you will, of the virus itself. We've been particularly concerned on the long-term impact that COVID has in multiple settings: quarantine and the isolation, social isolation caused by quarantine measures, but also the impact that it has on caregivers, particularly those that are used to working in more traditional settings and have had to adapt how they support, you support congregations, staff, and family, where most of the interaction is virtual. Even still, with most of the reopening guidelines here on the East Coast, many congregations are still either doing virtual worship or entirely, or some sort of hybrid version of that. Because we're talking about New York City more specifically, I just want to note that we're in phase 4 of the reopening guidelines issued by the governor's office. However, for the past few weeks, New York State has been experiencing localized restrictions, although the state is in phase 4, and this is due to flare-up spots of infections in different locations in the state. For the most part, downstate, mid-Hudson Valley, New York City, Long Island. There are specific restrictions within the state guidelines, which are also available on our guidelines document, which you can get off of NYDIS's website. Slide. So, spiritual care, by definition, for us, is a combination of the caregiving that takes place within a congregational setting or a pastoral relationship, but more formally in disaster spiritual care in the context of a caregiver who does field care for the general public, first responders, and other caregivers. So the purpose of emotional and spiritual care using the National VOAD, Voluntary Organizations Active in Disaster definition would be to help those affected by, in this case, COVID-19, draw upon their own emotional and spiritual resources during this period of pain or stress or grief, depending on the reaction an individual's having. It's to help them work through their emotions, including grief, and not take it away, not use words that nullify it or minimalize it. A caregiver's role is to provide emotional and spiritual care through being present, listening, as well as creating an environment of safety and security, made all the more complicated by virtual interaction. A spiritual caregiver, by definition, is a congregational leader, not just the ordained, but lay people in caregiving ministries as well. And we're there to help individuals, families, family systems, households, family not being necessarily the nuclear, biological, genetic relationship, but whoever people make a home with. Could be roommates, could be people living in community, religious community. It certainly could be families, nuclear families, biological families, families by adoption as well. We want to equip anyone we're caregiving for with the tools necessarily for them to cope with the crisis that they're now facing. But I want to point out that this is far more complicated than it is textbook. We're in a conflicted election season with a lot of anxiety. We're going through a period in our nation where we're having deep challenges with addressing issues of diversity, equity, and racial justice. We are also seeing disparities in infections in communities of color, particularly Black and Latino communities in the United States. Those are all complicating factors to what people in the United States and in our congregations have to face during this crisis. Slide. So this is a graphic to point toward that challenge. There are biological factors. We don't, for instance, understand why Native Americans, Black Americans, Latino Americans are disparately impacted. Some of the reasons are known, others are not. Social factors contribute to those biological factors as well. Many communities of color in the United States are living in urban settings where the population density is higher. They can be living in public housing, multi-generational housing. Some of those reasons are social, some of those reasons are economic. Psychological factors, if you know you're more vulnerable than someone else, that creates greater stress. And if the situations that make you more vulnerable are not something you can consciously change, that creates psychological stress. And then spiritual factors. What are the support systems around us through communities of faith or our own spirituality that influence our health and wellness? That we're looking, obviously, for the sweet spot found deep in the interconnected circles, one tiny little square, where if someone is healthy, if they have a strong social network, if they're emotionally well and spiritually well, their coping mechanisms are stronger, better, more resilient than someone who's missing some of these concentric circles, perhaps someone who has asthma, or someone who has no family system, or someone with profound mental health challenges, or someone who's lost their faith and hasn't figured out how to reconnect. Slide. This is a emotional and spiritual chart based on the life cycle of how a disaster impacts individuals, emotionally, spiritually, physically, all of the factors we're looking at the previous slide. We are, because we're in a pandemic, beyond warning and anticipation. We're in the impact phase, but we also have some households, some communities that never were impacted by COVID. They haven't had infections or deaths. Others have, and they've flatlined, and they're in an aftermath and assessment or relief phase. Others lost their jobs, but now they are reemployed. Perhaps they were ill and now they're healthy. And so each individual often is in a different phase. You could have 100 different individuals in one neighborhood that are in different phases of the impact, depending on how it's affected their life. Nevertheless, the pandemic is ongoing. I hope that science is clear to everyone, but the pandemic is many, many months, potentially years away from being addressed. Whether a vaccine comes or not is unknown. Whether or not people will take it or not is known. We know some people will not take a vaccine. There's a lot of uncertainty about where we are currently. Uncertainty creates ripple effects into the economy, into our spiritual life, into our physical health and wellness, into our social networks. So these are all areas of profound concern the longer the pandemic goes on. What is the cumulative effect, if the onion effect, as some people like to talk about, psychological effects, the layers of complicated grief and stress that are related to an open threat. Slide. So mental health during the pandemic, many challenges. I think most of them would not be a surprise to anyone. If you have mental health challenges, this is complicating them. If you haven't, this is potentially the root cause of them. And how do we address those challenges is one intervention that we have to look at as a caregiver. Chronic mental illness, rather than situational episodes, makes that more complicated. You could certainly be depressed because of social isolation and not connecting to corporate worship and these kinds of things, but whether that's complicated by the fact that someone has a history of clinical depression or seasonal affective disorder as we go into the winter months, or postpartum depression, or substance use or abuse, these challenges are amplified. There are profound mental health inequities in some of the impacted communities that we're talking about. Poverty, literacy, race, racial inequity, immigrant communities who lack English proficiency, all of those things create additional inequities. A lack of access to insurance or the resources to support mental health care. Legacies of discrimination and racial violence, which we've talked about a little bit, which I talked about a little bit a few minutes ago. If you were Native American in America today, living on a reservation where infection rates were 5, 6, 10 times higher than they are in other communities, and there's a legacy of your community not getting access to care, not being supported, that is complicating access to mental health care. Socioeconomic disparities always complicate recovery and response after disaster impact. and that's no different this time, except for the fact that we are also having a huge economic downturn and massive unemployment, challenges with access to food and other basic human needs. When you're in survival mode, you often cannot navigate how to take care of yourself well, because you're just figuring out how to survive. Disproportionate impact on Black and Latino communities is a fact, an undisputable fact. Native Americans should be included in there as well. Asian and white populations, dramatically less, but more in the Asian community than the white community as well. Pre-existing realities of our challenges in this country are magnified by this crisis. It's enormously stressful. There's a constant campaign of misinformation, as well as willful misinformation, denial of science, complicated by a political environment that is really hard to navigate, even within a single household sometimes. Multiple losses. COVID-19 has had a very dramatic impact on the homeless population in New York City, for instance. And we've had a large number of clergy fatalities in New York City, more than 100 clergy dying from COVID-19. Mostly because of being exposed in their routine ministry work, not because they were necessarily going into hospitals or doing clinical work, but just day-to-day interaction with parishioners and the public and the homeless and those coming for food pantries and all the other ways that caregivers are at higher risk than someone who's simply working remotely at home. Early altruism, heroic responses give way to disillusionment and fatigue. You can keep up being a hero and working 24 hours a day for a while, but not for long. And for many of the clergy that have participated in our webinars over the past 7 months, there's a repeated theme of fatigue and challenges with leadership conversations about when to reopen and when not to reopen and what you can afford to reopen and whether or not the plate offering is missing, critical income that is destabilizing congregations, which are ultimately small businesses, small nonprofits. Again, hard to be a hero when you're just trying to figure out how to get paid. Just trying to figure out how to keep your family together, keep your leadership board from unraveling and forcing public worship, which is potentially unsafe. So yes, many complications. Slide. This is, not surprisingly, I would hope, a look at emotionally how we cope with trauma. There are stressors at every turn in this chart, whether or not we know, for instance, there's been a flight from New York City since COVID-19. People who have wealth and mobility can leave and go someplace that feels safer. Move home with mom and dad, go to your vacation house in the Hamptons, sell your apartment in New York City and buy a house in Scarsdale, you know, whatever you can do when you have economic wealth and power and mobility, or sometimes just desperation without those resources. Fear is a strong motivator. The impact period is ongoing. So for many people, they feel like they're stuck in that first dip and they've never gotten out of it. Others probably feel like they've climbed out of it and gone through this cycle multiple times at this point. that honeymoon period where you hear that corporations are giving billions of dollars and food is getting out and the hospitalization rates have dropped and aren't the doctors all heroes and wonderful, and then we have hotspot problems and instantly everybody feels vulnerable again. Or they hear that other states that weren't following strict lockdown procedures are infection flare-up zones, and that triggers us stories. Every week there's stories about some church service, wedding, funeral, party that turned into a super spreader event. That's a lot of fear, I think, for a caregiver, for clergy, for lay leadership boards, to think about, oh my gosh, like maybe our bad decision caused someone's hospitalization or death. And it might be true. It might be. The question is how much of that is reasonable risk and how much of that is reckless risk. And are we really honest with ourselves about those things as well? And also, are we beginning to adjust to like COVID or the pandemic as a new normal? And then there was an article this morning that in Alberta, Canada, there's the first case of swine flu transmission to a human being. So 2020 has just been awesome, right? Lots of really normal things happening in 2020. So yes, now the CDC is watching another potential outbreak of something else that has, swine flu has gone epidemic before. And what does that mean? Although we have some swine flu vaccines, so we were a lot farther ahead on the swine flu than we are on COVID-19. Slide. So, unique challenges providing spiritual care in a crisis setting, which is not necessarily a disaster mass care setting, but certainly is a congregational setting, a ministry setting, if you will. Traditional modes of worship, community life are suspended. We all know that. Lots of negativity with governors now announcing that families shouldn't gather for Thanksgiving, for instance. These life events become trigger events for all of us who go through crises. We look for life events to bring family together, to re-strengthen bonds, to support one another, to get a hug from grandma, 20 bucks from granddad slipped quietly in your hand, you know, all the things that kids look forward to that normalize family interactions. And of course, some people hate family gatherings and are probably relieved that there's no Thanksgiving this year. So saying, oh, I'm sorry, there's really going to be no Thanksgiving this year. And some people inside are thinking, thank God. First time in my life I'll be able to get out of a holiday because I hate them. The duration of physical distancing is also about intimacy. And I think we have to be honest about that. You know, if you are afraid of spreading the virus, intimacy is one of the things that goes out the window first. Intimacy can be anything from grandma's hug to sexual intimacy between intimate partners, and something that is important in those relationships. Think about what it was like when you were 16 and dating somebody who you really want to be in a relationship with, and all the social pressures of dating as a teenager in general, and then being told, you know, like for the next 8 months, you're never going to find any way of spending any intimate time with them. And what does that mean in terms of normal development and normal relationship development skills that teenagers are now missing out on because they are physically rarely around one another. Worship gatherings have gone online. Some congregations report that attendance is better than it's ever been because of online worship. And I wonder how many clergy and lay boards wonder if we'll ever go back to a point where everybody gathers, or if a lot of people will want to continue to do virtual worship because it's less commuting, less annoying, you know, and others that are desperate for corporate face-to-face worship. They miss the music and the incense and the bells and passing of the peace and all the other rituals of interaction that bring meaning and wholeness to their life, especially maybe if you're a widow or a widower, and church, synagogue, mosque was that way you interact with community and keep memories of people that are passed alive. Life events such as baptisms, bris ceremonies, weddings, funerals, burials have been dramatically changed as well. So even when someone dies, sometimes it doesn't feel like it's a real funeral. It's some edited version of that. Virtual spiritual care isn't the same thing as face-to-face spiritual care. Even without touch, a handshake, a hand on the shoulder, or an embrace, virtual feels less private. Virtual doesn't quite get the full body interaction. You can't observe the person and their tics and twitches that expose their discomfort in pastoral conversations that sometimes give you triggers to explore further the stressors that somebody's under. Phone calls, online platforms are less intimate, less harder to establish trust for some people, and others easier. For young people who are used to interacting virtually, this is potentially more comfortable than someone my mom's age at 93 who thinks, you know, all electronic devices are perhaps, you know, suspect. You never know who's listening, all that sort of thing. Slide. What are the common signs of stress? The physiological, the mental or emotional, their impact on relationships, and peer-to-peer relationships, intimate relationships, family relationships, and our spiritual life. In the context of the pandemic, there's almost no way every single one of those things has not been disparately impacted throughout the entire pandemic or occasionally during the pandemic. And if we don't live with observant individuals or have a chance to check in with our friends and support systems, sometimes we're not even noticing that those things have been impacted. Nobody's walking up to you in school saying, you look like you're having a bad day. You have to actually seek out someone and see if they notice, which isn't really, that's not a teenager thing, right? Next slide. Stress, feeling anxious, lonely, or sad are common reactions to conditions that we're currently seeing, right? Social distancing, isolation, and or quarantine. Those are all complicated, of course, by any of the previous mitigating factors that we talked about. Physiological, psychological, sociological, spiritual. Slide. Symptoms of stress continue for a significant length of time. They're not paralleled by external factors. Symptoms of stress are magnified, perhaps throughout the entire day. I'm certain today, waiting for election results is stressful to everybody that cares, right? On top of whatever other stressors we're facing. And perhaps whoever wins is going to be 4 years of stress for you know, millions of Americans potentially. Symptoms of stress begin to affect a person's ability to care for themselves or be in a relationship with others in more and more ways than we potentially want to talk about as families sometimes. If your relationship was troubled to begin with your significant other, being locked up together may have strengthened that relationship, or it may have caused greater challenges to the relationship. The time apart was actually healthy for the couple, and together challenges are amplified. We know that there's increased risk of suicidality, particularly in young people during the pandemic. And the traditional systems that they have to seek out help are not necessarily available to them if they normally go to a school counselor or a teacher or a youth minister or a peer counselor in school. If you're virtual and you're pretty much locked up with your family all the time, other than rare occasions when parents agree that an environment is safe to let a child go into, those are making those kinds of decisions are making things very challenging for kids. And also, what would it be like? Would it be like to be living in residential care as an elderly person, and that you're already isolated in those settings? But if visitors are banned, it's hard to know how long that's going to go on and when you might lose hope that you'll live long enough for things to get back to normal and for people to be able to come visit you. So a great deal of stress, which then impacts your wellness, your physical wellness, and complicates your medical realities if you're living in a nursing home, for instance. Next slide. Signs of traumatic stress: panic, hypervigilance. We see this being lived out in some really, I think, unhealthy ways. People getting really ticked off about other people not wearing masks. Well, you don't have to wear a mask if you're more than 6 feet away from somebody else outside. So why are people getting yelled at on the street for walking down the street without a mask on when they don't need to be wearing a mask? So there's assumptions being made about the medical advice, but those are based on fear, right? People are afraid that maybe that's not true, and maybe everybody should just be wearing a mask, and if you're anywhere near me, I want you to have a mask on, whether or not it's according to the medical guidelines. Re-experiencing traumatic events through distressing memories, so in flashbacks and dreams, right? So there are many of us that have been through other traumatic events in our life where we felt isolated and not supported or poor or vulnerable. And if we're reliving those previous traumas as a result of the current conditions of the pandemic, that person is dramatically more vulnerable to the traumatic impact of stress or post-traumatic stress. Losing touch with surroundings and memories, difficulty sleeping and concentrating. You probably need to add things in there like overeating and not exercising and all the routines that normally we were able to keep, but we somehow are challenged in keeping during the pandemic. Feeling more irritable than usual, constantly angry. And is that about the pandemic, or is that about other inequities, injustices, or traumas that are ongoing currently? Becoming withdrawn and avoiding reminders of previous experiences of stress or death or grief. Finding ourselves unable to take pleasure in anything or anyone. Those are all the signs of traumatic stress that lead us to be concerned that a clinical diagnosis is something that should be thought through, considered, consulted on, depending on duration. So if any of these things lasted as signs or symptoms more than 2 weeks, that should be of concern to us as caregivers about ourselves, if we see these signs or symptoms in ourselves, or about others that we're caregiving for. Slide. As faith leaders, we may be at risk. I would say we are at risk of secondary or vicarious trauma. That would be a caregiver in any role, certainly clergy, but anybody in a caregiving profession during the pandemic, social workers, mental health professionals, clergy, lay caregivers. Of being traumatized through exposure to multiple deaths, family grieving, or alternatively by repeatedly not being able to be with those who are dying or their families. As a faith leader in a congregation, it's our responsibility to be bedside often when someone is in the process of dying or very sick and might be dying. It's hard to be present virtually for very long. It's hard to be silent and be a presence when your presence is just virtual. But we try, and often we're not necessarily hearing the confirmation that we're being effective in that. And that has an impact on us as well. But repeating this over and over again is a secondary source of trauma for caregivers. Slide. Why is self-care important in working with trauma victims or survivors of acute stress? How aware are you of your level of compassion fatigue? What do you do for self-care? What might be some barriers to self-care? What kinds of things can you do after dealing with traumatized or stress people that we're taking care of? How do we take care of ourselves following those incidents? And who can we count on as caregivers? Who can you count on in your life that are taking care of you? So one of the biggest challenges for caregivers is being self-aware enough to know that we need care from the appropriate source, so to make sure that we're being cared for. So are we looking for care from our congregation members? Or are we looking for care from our families or friends? Or are we not looking for care and potentially slipping into episodes of compassion fatigue or depression or anxiety or stress? So would anyone like to share on any of these points? You'd have to unmute if you want to do that. Sorry, should have said that. Nope. Okay, we'll move on to the next slide. So it's not quite populating yet. There we go. So starting next week, we are going to have a COVID self-care challenge where we're asking individuals, particularly faith leaders that can set an example publicly. You can ask your congregations to participate as well, to share photographs or little video clips about how we are intentional in seeking out stress release. You can't tell from this image, but this family here, 2 men and a young lady, are there we go, they're dancing. Little self-care video. There's a woman riding a bike, another woman reading. So we're looking for caregivers to take a photograph of themselves doing something that they are intentional about in their self-care. Hard to take a picture of yourself praying. It's probably a little bit too easy for clergy, so I think that might be cheating a little. But it's a little bit fun, but it's a good opportunity to give people ideas and also witness to self-care, which I think is also important. And it also gives some people permission to talk about the fact that they're either not seeking out opportunities for self-care or that they are, and maybe people don't even know what they do for self-care. Fred and I have been working together for many years. I know he's an avid mountain biker. I've seen proof on Facebook that he mountain bikes. Hard to take a photograph of yourself mountain biking. You might actually need like a helmet cam or something. Sounds a little dangerous, Fred, be careful. But you know, I think it's important for people to get an image in their head of how the people that care for them take care of themselves. And I'd love the idea of getting kids involved or spouses involved if the outlets that we seek out are something that we do as a family together. So it's a challenge. We want you to post your photograph or little video, maybe get your grandkids or siblings or spouse to do it with you. But it's a great opportunity, hopefully, to do something fun and also release a little stress. See how many likes you can get on social media. Get the like endorphins moving. Okay, next slide. Best practices for care need to include some of these things. So this is kind of what we're looking for in the challenge as well. Are we following pandemic safety practices? Like, it would be really awkward to see somebody put up a video of themselves singing in church with a bunch of other people without masks on. Not following pandemic safety practices. Caring for our bodies. Now, you're more than welcome to pursue six-pack abs, but that's not really what I'm talking about. The question is, are we doing things that are healthy? Not eating too much, not drinking too much, exercising as much as we can. It doesn't mean you have to be skinny. It doesn't mean you have to have six-pack abs. But it does mean that there's ways to take care of our bodies, and there's unhealthy things to take care of our bodies. So hopefully nobody does a COVID self-care challenge showing themselves like doing shots or something. Move and stretch. Are we getting up and stretching? I will say, at least for myself personally, the constant Zoom schedule every day sometimes means sitting for hours, and it's a bit insane. And so I've started to try to intentionally schedule time between Zoom meetings whenever possible, so that I'm not doing Zoom meetings back to back all day long. Connect with loved ones. Out of sight, out of mind sometimes, but are we really seeing the people, talking to the people that need support from us and that we need support from? Are we delegating as much as we can? I love to delegate work to Helena and Susan, so I don't have to do it. So, are we delegating when we can to those that can help us out? And are we spreading the number of people we can delegate to? Because I think that's also important as well. Limit our exposure to news about the pandemic. Facebook is a terrible place to educate yourself on the pandemic. So is Twitter. So, are a lot of media outlets. Like, there's only so much pandemic you can consume every day. And I think sometimes we're better off reading up on medical resources than we are on news outlets and social media, which often is, it's clickbait. Headlines to freak people out and make them read. Those are emotional reactions and not necessarily thinking things through. Creative outlets. Are we doing arts and cooking and macrame and whatever else that gets our creative juices flowing? Gardening, dog walking. Taking time to read, sit still, intentionally, putting the iPhone down, maybe shutting off the TV, just getting quiet headspace time. Can't go to get a massage most places, so all that kind of spa relaxing is not easy to get to these days. And are we being gentle on ourselves? I've heard some of my seminary classmates talk about like how much stress they're under, and how they constantly feel like they're having to decide whether or not they're being judged for doing things well virtually. And that's an additional stress. I think most clergy second guess their sermons to begin with. But is virtual sermonizing, preaching, adding additional stress? And are we cutting ourselves a break and recognizing this is something that's hard to keep up with? And nobody in seminary taught you how to do virtual services, unless you went to like an amazing seminary 50 years ago that decided there would be a pandemic someday. I don't know. We can move to the next slide. So these are some of the resources that are available. We have at the bottom of this page, you can also find it on NYDIS's website. This is a mental health toolkit for faith leaders that NYDIS developed with the Interfaith Center of New York and the Mayor's Office of Thrive. It's got a lot of great information in it. Slide. We have a bunch of tip sheets in English, Spanish, and Chinese on self-care, disaster mental health, disaster spiritual care, continuity of operations planning, risk communication. Those last two things, I know they sound a little boring, but if your congregation has a good continuity of operations plan, you will have less stress in your life. Promise. We have this new Disasters and Religions app that launched last week. There's a lot of great information in here. It's free. You can download it from the Apple Store or Google Play Store. Lots of information if you are caregiving in multi-faith settings for the different challenges that face us as caregivers when we're trying to be effective in caregiving to diverse populations. So on a cultural and religious competency level. So also it's a great thing to sit down and get some quiet time with if you would want to explore. It's got an enormous amount of information in it, and you really do have to explore it to get through it. It was designed with chaplains and clergy in mind that are caregivers in multi-faith settings. Slide. This is a hotline for frontline workers, so people working directly with the public in stressful settings, which would include mass care settings like feeding operations, clinical mental health, medical settings, chaplaincy settings, perhaps complicated congregations for that matter. Next slide. This is the Disaster Distress Helpline. It's funded by SAMHSA. This is it's a text email resource where people can interact with a clinician and get referred to direct services. Next. This is NYC Well. And again, you'll get all these slides so you don't have to write madly away. They'll be sent to you by Helena. NYC Well can be called as a crisis response team. They also have talk support as well as referrals to clinical care and can expedite hospitalization for anybody who's suicidal or is in need of adjusting their psychotropic medications, someone in need of psychiatric care, Over 200 different languages are available through NYC Well, and it's a 24/7, 365, always available, always working, just like 911 or 311 because it's meant for folks in crisis. Slide. Keep the suicide prevention hotline in mind, and also the National Domestic Violence Hotline. There's been a tragic upswing in suicides and attempts, as well as non-suicidal self-injury as a result of COVID-19 and the lockdown, particularly amongst young people, and also a tragic increase in domestic violence, both with intimate partners and child abuse during the lockdown. Some of that directly related to substance use and abuse, but some of it simply related to the stressors of being together in a household with individuals who are not restraining themselves when it comes to inclinations toward violence. Violence also, let's remember, is in word as well as in physical abuse. Often verbal abuse is just as damaging psychologically as physical abuse. And obviously, many of us are mandated caregivers in that regard. These are the 4 actions, again, the only reasonable actions that lay people can take. Stay home if you're sick, keep 6 feet apart unless you're wearing a face mask, 12 feet apart if you're singing. Wear a face covering whenever you're around other people outside of your household, particularly around anybody who's health vulnerable, and practice not obsessive, because that gets in the area of disorder, but practice healthy hand hygiene. Touch as little as possible, keep your hands clean, wash your hands when you come into the home from outdoors and you've been touching surfaces. There's plenty of evidence that COVID does stay alive on surfaces long enough to be picked up and retransmitted when we're touching things. So always important also not to touch our faces, in addition to having that good hand hygiene. And these are called the core 4. So the 4 recommended actions to prevent COVID-19 transmission. And remember, not all masks are equal. Masks with valves are not effective. They pass the virus. Masks that are homemade out of 1-ply fabric are not effective. Things like bandanas, not effective. Has to be 2-ply weave or more, and preferably clinical quality or filtered cloth masks are the safest. Testing is free in New York City MD, all the H&H hospitals, but you can look up online or text where to find where to get tested. Any questions I can answer? I know you're all super excited to get on with taking videos and photographs to post for the campaign when it starts next week.
We are at time, Peter, so
can we stop?
Q&A.
Yeah, can we stop sharing the slide?
Sure.
Okay. Any questions or comments that anyone would like to offer? Everybody's feeling very shy today. Deneen Ferguson, you've never been shy in your life. She's not unmuting.
She's in the chat. She said she's not shy at all.
Are there any questions in the chat? No?
Are you baiting me, Peter? Peter, you're baiting me.
I'm baiting you. That's not one of the prohibited behaviors of the pandemic.
Oh, okay, okay. Multitasking, just multitasking. Good time, good content, timely content as always. Thank you, NYDIS and Peter Gudaitis. Got my rhyme going on, my bars.
Thank you, thank you.
Yes,
Any
sir.
thoughts on self-care that anyone would like to share?
I think what I've noticed most when we think about self-care is that in some ways our understanding of self has to evolve. You know, the self that we were or thought we were before the pandemic is different now afterwards. And part of that is that because of stress, we just can do less. We have the same responsibility. So how can our understanding of self now become healthy and still work within the parameters that we're calling to do? So I think there's a kind of existential change that has to happen deep within all of us coming out of our prayer lives.
Thank you. We're over time, so I want to respect that. Any final comments from anyone?
Good afternoon, everyone. I would like briefly to say thank you to Helena and Peter, as usual, worthwhile and provocative and helpful. So thank you. I would want to say, for me in my pastoral practice, I find asking people to identify their sources of hope, whether it is through a spiritual lens or not, is something that I feel people have felt it has been helpful to them in terms of coping and finding their strengths each day. And I would emphasize, you know, how are you doing on sleep and laughter? I'm deliberately, because I live alone, I am watching a few shows that I never would have watched before because I really need a source of laughter every day. That doesn't always work as well as I hoped. But I think those are the things that I would want to share with everyone if we were in a room together. And I miss being in the room with all of you. So thank you for this.
Thank you. Thank you, everybody, for joining us today. Again, Helena will send off a copy of the slide deck and a video clip recording of the webinar today. I encourage you to look at the resources and stay well.
The recording for today you can access once you complete the evaluation. So we have some incentivizing happening, but as soon as you complete that 2-minute evaluation, you'll get the link to the video. All right, take care, everyone.
Bye.
The evaluation link will be sent in an email. I see the question.